Good afternoon, all. Thank you for joining us today. We are so excited to have you here for our webinar on MedTech and health or digital tech, right? So we have our speakers here today, Dr. Jawad Arshad and Diana Kocheva, who are experts and are going to share their wisdom with us today. And thank you to our team, to the Vendorship team who is handling this. And without the team, this webinar wouldn't happen. Again, this is our weekly webinar, and we're excited that you've joined us today. And Anu is moderating from the back end. She is the one who's sending you the polls, and please do ask questions in the comment section. We'll make sure that we get the questions answered to you before the end of the session. And we're also happy to have my other team members here, Madhu, Anu, Sabina, and Susan. So thank you all for joining us. It's an important topic, especially this time, the COVID-19 time. We're going to definitely discuss how the practice has changed, how the technologies that are coming up, how it has actually improved, or is it an opportunity for many more? So to give you a brief background about Dr. Jawad Arshad, he is an emergency care physician. So Dr. Jawad, we want to personally thank you, all of us who are listening, and from me and Diana as well, for being in the front line, especially when most of us were staying safe at home. We thank you for your service in the hospital.
Really appreciate that. Thank you.
Thank you. And you are also, which we see a very rare few, but good ones, an entrepreneur. You are the CEO of Warm Health Solutions. Definitely, we'd love to hear about it as we move forward with our discussion. So thank you. As a serial entrepreneur, we wish you all the best. Diana, thank you for joining us all the way from Kyiv.
Yeah, right.
That's amazing. So you are going to give us probably a global touch on what's going on with digital health. So thank you. And you are representing Intellisoft, and you have the expertise with cutting edge in the medical technology space. So thank you for joining us. So I want to ask you a general question before we head to our discussion on health tech or med tech or digital health. Let me start with Dr. Arshad. Dr. Arshad, what is that one lesson or skill that you learned during this lockdown period? And I'm assuming you are not in much of a lockdown, but I'm sure you must have learned something during this period.
Yeah, absolutely. I mean, we've so clinically, I work a little bit, so I don't really work as much as I used to. But so clearly not in traditional lockdown in that way personally, but our tech team, of course, is in lockdown, which has created some challenges, but opportunities as well, just like anything else. So I think the one lesson that we have learned really is to be resilient and to be flexible, right? I think the flexibility that our implementation team, our software team has shown, in perhaps getting on more Zoom calls than they are used to, or managing work remotely, right, or submitting or having team meetings online and so on. So I think that flexibility is paramount, and that really is, I think, one of the underlying themes, right, of the new economy of the digital age, where you're really anticipated and expected to be persistently flexible, and because times change faster than they used to.
Definitely. Thank you so much. How about you, Diana?
Well, I guess I will start, from personal insights. What I learned yoga. So I'm doing yoga every day. So, again, it's just because before I was always in business trips. I was always flying somewhere. I was always in the conference. So I never had a routine in my life. So this lockdown changed my life totally. But if talking about, professional side, again, I used to work mostly by myself and working with client face-to-face meetings. Now we have everything is going online, but again, for being IT manager and working in IT industry, it's not that much difference. Still, we have global teams around in different countries, so we can all work remotely. But one thing that I learned, that kind of sharing is caring. I'm speaking with the best minds from all over the world. I'm speaking with people from healthcare industry. Now we all actually find time to speak with each other and share knowledge that we didn't have a chance before. We didn't have time to speak. And so one thing that globalization and COVID learned that now we have more time to speak with each other, even if we're all sitting at homes.
You put several points in there to note. One is yoga, so you've self-disciplined, and you've learned sharing is caring, and so that's a good lessons and many good lessons to learn during the lockdown period. So let's continue with the question for you, Diana. The word medtech, health tech, digital health, it's all probably overhyped, or there's no clear definition. Are they describing products? Are they describing technology? Are they describing apps? Are they describing software? So if just to make clear as we go into the discussion about medtech, can you tell us what is actually digital health?
Okay, so there's no correct answer or no right answer for this question. Maybe I'll start telling that what is for me. I came from financial world. I came from classical fintech. And when I entered MedTech several years ago, I was like, okay, what's the difference? You have also sensitive information, and plus you have high-loaded systems, just because usually such solutions were made for a lot of users. For me, MedTech, it's when you're taking bureaucracy, classical medical healthcare with old documentations, old-fashioned style, a lot of paperwork, and you're trying to automate the system when you're trying to digitalize, to put more information on the cloud, to take instructions from your technical equipment also in one place, when you're trying to make connection between doctors and patients, you can all put it into MedTech. So for me, it's when you're trying to revolutionize bureaucracy industry as medical care.
Very well said, and thank you so much for that answer, Diana. Dr. Arshad, let's continue with the same note about medtech, right? So there are probably 500,000 medical devices or technologies available, and so my question is, it can sometimes help. It's basically to help treat and monitor and provide better quality of care for patients, right? So can you tell us what are MedTech's products and services used for?
Yeah, so I think, with anything simplistically, right, there are two main categories that they fall into, right? One is it is either revolutionary, right? It's disruptive. It's trying to change how we think and therefore obtain care, right? And the other is that it's an enabler, right? So it's basically taking your existing workflows and improving them. And I think that, one of the big challenges in healthcare tech really is that, regulation, it holds a lot of things back. The other problem in healthcare is that everyone is a potential consumer, but not everyone is a user, right? So all of us have a need for healthcare, right? So when you are thinking about it from a business standpoint, you're imagining 100% of the population and how they would interface with it. But really, at any given point, right? I mean, no more than 3 to 5% of the total population is going to be interfacing with you, right? So then, how do you parse that out? So I think that that's why you have close to 500,000 companies and technologies and so on out there, because everyone is trying to find that one thread and pull on it, right, and see if they can make this work for themselves. So I think those are clearly huge challenges. The other problem is that healthcare is something that is very personal and sensitive to the consumer, right? And especially in the US, where we have a very different way of thinking about obtaining healthcare, right? So most people have the idea that if I go to a doctor, I drop my Blue Cross card, and I should be taken care of, right? Now we know that obviously is not exactly how it works, but that's the idea that everyone has about what healthcare should look like. And so I think that so there is a lot of that education piece that's missing in the consumer, and then the providers, unfortunately, are just as blind, right? So I went to medical school in New York. When I come out of medical college, right, I have almost zero understanding of how the business side of the system works, right? Because in healthcare, there are two completely different sides. There is the delivery of care side, which is what we're trained on, and then there's almost no training and understanding of how the business side works. And then you're trying to lay on top of that this complexity of bringing in technology, right? So EMRs came out about 25 years ago, and everyone heralded them to be something that was going to be a savior, right? Retrospectively, we find out that there's actually no outcome difference, right? So we're not really able to save more lives. We probably aren't actually saving more money either, because all electronic medical records have become is just, more, greater way for you to capture charges and finances, right? So it works great for the finance department. It doesn't really work all that well for the consumer, for the patient, or the provider that has to interface with it. So I think those are the real issues with MedTech in healthcare, in my mind. Like, is it disruptive or is it enabling? And if it is enabling, then what is it enabling, right? And I think that there is a real disconnect, because the provider and consumer of service aren't the same as the person who is running the business side of things.
Definitely. And I think you touched base on our last week's webinar, which was on ag tech. And it's like, how do you teach the farmer technology, or how do you teach the technologist the farming? So it looks like you are better placed because you are a physician. You've seen what the ins and outs are, what are lacking, and you've become an entrepreneur. So you're trying to solve that gap. So you are well better placed. So Diana, the next question for you is: so we know when entrepreneurs are coming up with new technologies, and even a product in the medtech field, they're going to really have a very high returns, right? Once it goes into the market, once it's accepted. But what problems, and Dr. Arshad touched upon that a little bit, but what problems can digital healthcare and technology address? And what is your involvement in digital healthcare technology?
I'm more of a logical person. I really want to and trying to talk more about examples. So one last thing that came up to my mind is when so first of all, COVID changed every country in the world. Right now, hospitals are not safe place anymore for people. So one of our clients came up with the idea, it's nothing new, but again, telemedicine right now is booming. So they came up with an idea, not just create video application for doctor to speak with patient and to check their diagnosis, to check if they're infected or whatever. But one more thing that we have faced right now as a problem and challenge in many countries, mostly in US, lack of staff. A lot of nurses, they're not going to work right now, or they are working more shifts than they should do. And we came up with an idea to create solution like Uber-like application for finding nurses nearby. And right now, 82 different hospitals are using it, and it really helped people during COVID times. It's one option. It's like lack of staff. Second, it's again like hospital are not safe place, so you need to think how to self-monitor yourself, or to have virtual assistant as your physician who will tell you what you should do for the next steps. Third thing, it's again medical insurance. I was also I really like this industry, but they have a lot of challenges, and mostly we have problems in US. So they're always trying to find gaps how not to pay end users or patients, and we also modernize some of them. And again, my background in fintech is helping, just because we're integrating some innovations in payment system. So I can talk hours and hours, just because there's so many challenges and there's so many things that need to be done. Like, for example, one problem in states that doctors can't talk about their patients via WhatsApp or Facebook Messenger, just because it's sensitive data, and they can share even photos. Let's say X-ray of lungs, just because we all know that corona have like pneumonia disease afterwards. So they can't share this knowledge legally. So MedTech solution can be to create a chat that will be super safe and where they can share this knowledge between each other. So
Very nice. Yeah, I think you covered a lot there, and we would definitely be talking more about the challenges and opportunities as we move forward in our discussion. Dr. Arshad, did you want to chime in on that particular question? I do have another question for you, though.
Yeah, so I think, as I mentioned, one of the biggest challenges in medtech is the understanding of the end user of using the technology, right? One of Diana mentioned telemedicine, right? One of the big challenges in telemedicine, for example, is that if I get a patient onto a telemedicine session and they're using their laptop, right? Have they allowed their microphone to be on, right? Are they allowing the video to be on, right? Do they have an extension? What browser are they on, right? So there are all these things. And if you think about it, I mean, technology as we see it today is really something that has been evolutionary for most people, but realistically for the masses, it's really something that has come around in the last 10 to 15 years, right? So I mean, let's not forget the iPhone wasn't around, so there was no smartphone type of thing about only a decade ago, right? So if your end consumer is a 70-year-old patient, right, they have no idea how to interface with their computer. Now, if you are using an app browser system, yes, you can get around some of those restrictions because clearly mobile phones, or mobile devices, help you from that standpoint, but that's just a real problem, right? I mean, so you can make an appointment with a patient, but then, and the other problem is volume, right? So the number of apps out there, it is just so overwhelming, right? So I mean, for example, one of the things, our goal as a technology company is not to create some new technology, right? Our goal is not even to be the provider of service, nor are we interested in being the consumer of that service, right? We just want to create a standard platform so that all of these providers that are providing their healthcare service can communicate in a standard way with their consumers. So every time I land into our app, for example, I know what the interface is going to look like, which hopefully is going to help me interface and use it more, a bit easier, perhaps. And so I think lack of knowledge is a huge problem because once again, your consumer is is not necessarily up to speed with the technologist who's making it.
Sure. So, and that was going to be based for my next question as well. You touched upon it a little bit. So my question was, I know we talked about telemedicine, we talked about apps, we talked about the video sharing platforms, etc., and we talked about the risk management, right? And Dr. Arshad, there must have been a reason that you are doing what you are doing. So how can technology help healthcare system better manage relationships with patients? So I think if you can respond to your professional touch on technology and healthcare. This
Yeah,
question.
absolutely. Thank you. So I think that a relationship is best managed when it is between two people, right? I mean that's the simplistic way to look at it, right? So if it is between two people right now in our current environment, in any appointment that you may have with your provider, right, it is the patient and the doctor and the unseen insurance company, right? Because it's really a threesome. The problem is that the user nor the provider control the money, right? And that's really what it comes down to. Whoever controls the money is going to control the decisions, and that's the reality of life, right? So I think if you look at it from that standpoint, you say, well, then what is the solution around it, right? So I'll tell you, for example, that our medical providers, and I'll challenge you to go to any physician, and about probably, conservatively 95% of them, maybe 98% of them, have no idea what they get reimbursed for a service they provide. It's that kind of opaqueness and lack of transparency, right? If I have health insurance, and I call my health insurance company and I tell them that, hey, I'm going to go see this physician. How much is this going to cost me, right? You'll get some nebulous answer about how, it depends on your copay, and then your copay will be $20, and then if you haven't met your deductible, but then if your maximum out of pocket needs to be this and your deductible needs to be that, and then you'll get a percentage of the charge. There's no clarity in any of this, right? I have absolutely no idea what I'm going to pay for a service that I'm going for, and as a medical provider, I have no idea what I am actually collecting most of the time, right? I'll give you a great example that, when I used to run a clinic, there is, when you give an injection, right, you bill what's called a CPT code, okay? That CPT code has to be tied to an E&M code, which is your evaluation and management code. But if you're giving an injection, that also has to be tied to what's called a HCPCS code, right, which is the actual medication that you're giving. That medication has then to be tied to an NDC code, which is also what the medication manufacturer is, okay? The problem is that the NDC code can change, and it changes without you knowing. So I asked our carriers, our insurance companies, I said, hey, you know what, you guys will eat the cost of the HCPCS, right? We'll eat the cost of the medication because the NDC code keeps changing, and then the HCPCS doesn't go through, and then because of that, you guys deny the whole claim, right? And then someone has to go through it manually and fix it and what have you. So can we just not be paid for the medication? We'll eat that cost, right? Just pay us for the act of giving the injection. Right? And the answer was, of course, no. Right? Because as Diana mentioned, the goal of the insurance carrier, because that's the way the system is set up. So I don't blame them, right? Because they are playing to the system, right? So there's something wrong with the system. There's something wrong with their business model, right? The way the system is set up is that they have to hold as much of the funds as possible because, let's say, face it, they have a fiduciary responsibility to their financiers, right? If it is a stock company or not, regardless, right? So our concept was that we were going to connect that patient directly to the provider on cash basis, right? Because when I come to see you, I am going to pay for your service, and you are going to tell me how much you are going to charge me for that service, right? And if we can bring that kind of transparency, then we can cut out about, if you look at a medical practice, about 30% of their total revenue is sort of spent in this collection nonsense, right? So you spend about 8% of your revenue on having an electronic medical record. What are we doing an electronic medical record for at that point? If I'm not generating a claim or a bill, and then you spend about another 15 to 20% in having a biller that's going to scrub these claims and submitting them, and then of course you have collected the copay. Then you get an EOB from the insurance company telling you that, the patient hasn't met their deductible, so now you have to collect another $80 from the patient. Right? Why didn't I just collect like $70 from the patient up front and be done with it, right? I collected $20 when they came in, paid a credit card charge. Then I got a letter from the insurance company saying that the patient hasn't met their deductible, so now I have to collect another $80 from them. Now I'm calling the patient. Hey, you owe us $80. Can you please pay us your $80? Right? So it's stuff like this, that really I think has broken healthcare, right? Because of the opaqueness and this lack of relationship, right? That a patient has directly with their provider.
Yes, and yeah, and I'm sure people like me and many others can vouch for that. Okay, did we meet the deductible or not? And we can see the complicity, the complicated system that you have to run through running a clinic or a hospital or being a physician. So we definitely understand that part. So from what I'm hearing so far, Diana, so let's talk about it candidly, right? So there is technology, there are good physicians, there are consumers, and but we still say the U.S. health system, people continue to say U.S. healthcare system is broken. So if the technology hasn't helped, in spite of the resources available, can you tell us what are the most important advancements that has happened in the last 10 years digitally, right, in the MedTech field? Or what are the other new technologies that still need to be developed to fix it?
I guess I need to start with the first thing that just because I really believe in globalization, and I think that we need to add best practices from every country, in every country actually, it's data interoperability. Seriously. So even like sometimes even doctors in states, let's say I used to study in Wyoming, so doctor in Cody, Wyoming, wouldn't understand what doctor from Atlanta wrote, just because there's, I don't know, more than 100 ways to say that you have a sore throat. And actually data interoperability will help us to structure the data safely, plus in structured way. And so doctors from all the world will understand what you have. Just because the most important thing in healthcare, actually in every industry, but in healthcare especially, it's your personal data. More personal data you have on your mobile phone or in whatever, it's like, again, I really vouch for mobile health booming right now, just because more information the doctor will have about you as a patient, uh, more there are like more chances that he will treat you correctly, or he won't even do any harm to you. Sometimes when you're in emergency care, doctors won't know, and you're under like unconscious, and they won't know what allergy you have, what type of blood you have. So if you'll have all information in one place, let's say mobile phone, Apple are doing great job with medical ID. Uh, Again, structurizing data correctly. Second, unified the system, and third, given it to access for your personal use. Plus, I really believe that more data we're spreading, it's really helping for research, for finding, again, like vaccine for treating diseases correctly. So I wanted to start from this point. Second, what I really believe in artificial intelligence. Again, it became buzzword in every industry, but I really believe that, again, doctors, they unfortunately, just like us, like normal people, have only 24 hours per day, and they have tons of work, and we need to help them somehow to make the right decision, just because they can be tired, they can be distracted with some other information. So we really need to help them to make the right diagnosis, and so any kind of doctor helpers or algorithm for finding the right treatment will be also helpful. Uh, Again, if forgetting about like doctor, but if remembering that we also have pharmacy inside healthcare industry, I really believe in blockchain. It's a great technology that can help us to find fraud. Again, it's global problem. I don't know. In US, maybe it's not that much big deal, but again, in Eastern Europe, where I'm locked down right now, or in India, they still have a lot of problems with counterfeit, with medications that cost a lot of money, but they can do even harm, not just are not doing any good. So this can also benefit from this technology.
Very nice. So basically, you're saying that sharing of patient data is not possible without digitization, right? And I'm glad you brought up the AI. So, Dr. Arshad, do you think that at some point clinical computing and artificial intelligence are ready or already set to replace the human searching, for possible scenarios and conditions? Basically, my question is, will AI transform MedTech?
So I think the way to think about it is that is healthcare less or more complex than driving your car, right? So if you think that healthcare is less complex, then clearly we're ready, right? And bring on the AI. Right? But what we know, at least as a physician, I can tell you, when it comes to your healthcare, right, you are not going to be okay with a computer diagnosing you and then there not being a legal ramification, right? It's not that the technology isn't entirely there. It's not entirely there, but it's pretty close to being able to have a self-driving car, right? And yet GM just this past month shut down their self-driving unit. Right? Why did they do that? Because the barrier to entry is so high, right? And the medical legal ramifications of an accident and who's responsible. Is it the technology manufacturer? Is it the car? Is it the patient? Is it the driver, right? So it's the same thing in AI, in healthcare, right? So I am a traditional physician, right, who is entering into medicine. And so I, of course, take a completely different point of view from my MBAs, right? Because our business people love data because they have learned and I think grown up in financial fields and data fields and what have you, right, which are numbers. What we know in healthcare is that, as Diana mentioned, there are 100 ways to say a sore throat, right? If you try to collate all of that into one, which is what we use ICD-10, right? I don't know how many people on the call know what an ICD-10 is, right? But an ICD-10 is a quagmire, right? Which has as ridiculous a statement as, having a burn from skis, right? While you're water skiing, so you can get a burn on your body. But it doesn't actually have an ICD-10 for, a Foley complication, which is significantly more common, right? So when it comes to data, right, I am of the opinion that until you know what you are collecting, it's totally pointless, right? There's plenty of data out there, okay? We haven't been able to put any meaningful use to it, right? So we have 20 years of data on EMRs, right? I want to know what have we done with it, right? And what changes have been made? Because all we have done is that we have burdened your non-technologists, your providers, with having to put in more and more data, right? There is a reason why there is such a high physician burnout, right? There is a reason why physicians don't want to work with EMRs, right? So our solution, right, is that data should be looked upon more holistically, right? And as opposed to, getting the end user, the physician, to pick a diagnosis, right? Let's at least get the relationship first, right? At least let's connect the physician and patient first, right? Once we can at least bring some clarity to that relationship, right, and the payment structure, then we can think about what can we do for improvement of that healthcare, right? Because part of the problem is that there's no engagement. So, you talk about interoperability, do you know, I hope you guys know Epic, right, which is the largest EMR, right? Epic has something called Epic Orchard, right, which is their interoperability and, to be able to interface with third-party systems, which is absolute crap, right? Because they have no financial incentive to share their data with anyone else. Because one of the reasons they make money is that they tell the hospitals that, hey, you are going to get Epic and 50 other hospitals are on Epic, and now we will all be able to share data. Great. The hospital signs up, they spend hundreds of millions of dollars, right? And so I'll tell you that when I interface with Epic, and I'm an Epic super user, right? When I interface with Epic and I pull records from another hospital that is on Epic, it is essentially ununderstandable. And both hospitals are on Epic. How is it that we cannot get data that makes sense within the same system, right? So the bottom line is that there are silos that need to be broken down, and I am not convinced that, at least as a non-technologist, that data is going to be the answer. And I think that AI is also far away. It can help you maybe guide you make decisions. I'll tell you that as a physician, one of the biggest concerns with AI is that, I see you, right? I make a decision clinically based on your history and so on and multiple other factors that you don't need a CAT scan that you do need a CAT scan of the head, right? The AI is telling me that you don't need a CAT scan of the head, right? I override it. I get the CAT scan of the head, right? Fine. Nothing happens. We move on. My concern is that 1,000 patients later, right? What if the insurance company comes back and says, you always override the AI, so we are going to stop paying you for it now? Okay. So there are some real financial ramifications to using this type of AI and data as well, right? But out of those 1,000, by the way, I found 2 patients who you told me I shouldn't get a CAT scan and ended up having bleeds, right? Now, if I had missed those 2 out of 1,000, right, that would have fallen badly on me as well, right? So I think that, there needs to be a shared responsibility, and that's just not there, right? So, when something goes bad, I am responsible as a physician. When if I overutilize, then you are going to cut my reimbursement. I'm responsible again, right? So I think so there is no shared responsibility, and that's exactly what has happened in your self-driving world, right? I mean, we've been hearing about this for so long, and now you see sort of this coalescing perhaps, and people sort of saying, well, I don't know if it's ever going to come through or when it's going to come through.
So thank you so much for being so candid, and I could see Diana actually nodding her head a few times, and that was the question. I was going to come back. A good segue to challenges, Diana. So go ahead and chime in. And the question that I was going to ask was, what are the obstacles there are to greater or better use of technology in healthcare? One, obviously, we heard all this time, it is quite a challenge. So go ahead, Diana.
Yeah, I guess I will add some words to Javad. First of all, I believe in HL7 fire, so don't think about. I hate Epic as well, so yeah, we're using.
Oh my gosh, we have two people agreeing to something that they don't like. Okay, so Diana, what are the challenges that are available? Or obstacles? Because as we talked, Dr. Ashok touched upon the healthcare administrators, right? For them, they have to answer to the departmental goals or the institution's goals, and so they might face some. You might face some clinical reluctance or resistance from the physicians. But from your perspective, what are the challenges there are to actually greater or better use of technology in healthcare? And follow after your answer, I want Dr. Ashok to answer from his perspective. How can this be best implemented without affecting the cost to consumers and patients? But we want to hear from you. What are the obstacles, Diana?
Yeah, talking about obstacles, I guess I need also to start with responsibility that already Javad mentioned. That okay, who will be responsible? Developer who created an application, doctor who maybe just because of connection couldn't see clearly, or patient who are just going to professional and expecting consultation. So first of all, it's a really regulated sphere, like healthcare globally. It's super regulated and super bureaucracy everywhere. Second of all, I guess just because everything is super individual and in our bodies, and we can't, we don't have one algorithm for every human being. And no one can predict, full cycle process for every patient. So there will be always some exceptions, and we couldn't create one perfect product for everyone in the world, even for one particular group of people or for one particular group of patients. So it's really hard. And what I believe in, if startup want to be successful, they need to find really small, tiny gap that they can enter and challenge that they will solve for a small particular group. That's what I'm always suggesting my clients. And talking about obstacles, also I guess one more thing is just people really need to trust the doctor. And again, when you're going to the hospital and you're speaking with face to face, you are building trust and you're building relationship with every kind of application or products itself, like IT products. It's really hard to make connection between patient and doctor. Yeah, so that's what I think.
Definitely, yes. And Dr. Arshad would definitely agree to that. So, Dr. Arshad, what are the changes that can be implemented without drastically affecting the cost to consumers or patients in technology?
Yeah, I think, first of all, I think that cost to consumer can be reduced significantly, right? Let's not forget that only what is it, about 8% or something of the total healthcare spend is actually comes to the provider of the service, right? Which means 92% of the money being spent is not coming to the provider, right? So clearly there is a disconnect when the primary provider of service is only taking 8 cents on the dollar. Right? So that's one problem. The other is that I think I always go back to transparency. So why are we, for example, so concerned about, from a financial standpoint, about doing a CAT scan? Right, the incremental cost of doing a CAT scan is probably no more than $30-40, right? But we are going to bill as a hospital $900 for it. But if you pay a cash in an outpatient center, you can get that same CAT scan for $200. So you see, so there is this wide range of variability, and variability, in my opinion, is the death of any automated system, right? Any automated system and automation necessitates, even if you take into account some individualization, right, but still necessitates there needs to be some understanding of and standardization, right? So our goal, for example, is that we want this opaqueness of third payer party systems, right, to be removed from episodes of care that are fairly cheap to begin with. Right? So when you think about your homeowner's insurance, right, if someone comes and fixes your water heater or your furnace or your lawn cutting, right, or someone comes in and paints your home or changes your shingles, right, you do not submit that to your insurance, because insurance by definition is supposed to be catastrophic, right? What we have done is we have sort of, unfortunately, sort of bastardized the system in healthcare, right, where we think that my routine care should come out of the insurance and my sick care should come out of the insurance. And some people obviously are sicker than others. It obviously takes away personal responsibility as well, right? So now if you all are paying for my care, what reason do I have, besides obviously feeling poorly, to try to modify my behaviors, right? So I think that having a third-party paying system, in my opinion, is the underpinning of the failure of the healthcare system in the U.S., right? So if we can get rid of third-party paying system for outpatient care. Now, yes, there are events in life, just like, God forbid, a house fire or, a serious car accident, where you do need, right, to rely on a third party to help you cover those costs. So that, God forbid, the diagnosis of cancer, right, or you end up in the hospital. Yes, you do need some kind of a plan to cover for that, but you don't, and you should not be paying for a plan to go see your dentist or to go see your primary care doctor, or even to have some outpatient procedure done. So I think so. Transparency and that direct connection, removing the third-party payer from these encounters, can really help get us there.
Definitely. Thank you for your perspective, Dr. Arshad. And my next question was about, from what I'm hearing, looks like technology is as a facilitator, right? But it's not come all and solve all. And also addressing the inequalities of access to health, right? So what do you think as a traditional practice, and Diana, the question goes to both of you, from moving away from paper-based practices, getting into technology, what are the problems that cannot be solved through digital health and technology?
So my question will be simple, really, like in one sentence. Any challenge or any problem can be solved with technology. I mean, not in 100%, but it can be catalysator for solving it, or it can reduce it significantly. So this is easy.
Yeah, I think the biggest problem in healthcare is relationship, right? So if there is a third party that's preventing that relationship, that's a problem. If I have opaqueness in my relationship with my provider, that's a problem, right? If I have a difficulty in maintaining that relationship, that's a problem, right? So by maintenance, I mean, I have to come in every single time for my office visit. Why can't I do a telemedicine visit, right? So, and of course, one of the reasons physician community in general has balked at the idea of telemedicine is because we don't get reimbursed. So your reimbursement is much less, because obviously I need to bill an E&M code, and the best I can get up to is a level 2. But if I see you in person, maybe I can get to a level 4, right? Level 2 is going to reimburse $35. Level 4 is going to reimburse $80, right? Why would I take 60% less, spend the same amount of time with you, right? And it doesn't make any sense, right? So I think, so I think that in our opinion, right, in my opinion at least, if you can connect that patient directly to the provider and take out the third-party paying system, right, then we can start to at least address that relationship problem, right? So because then we can have a direct relationship between the patient and the provider, right? So if I don't like you, then I can go see someone else, right? If we can get rid of the opaqueness in how I'm paying you and what I'm paying you, because if I don't find the value in the dollars that I'm giving you, then I can think about doing something else, right? Then you can also tell me that, hey, you can connect with me on telemedicine. I'm going to bill you the same, or you're going to have to pay the same, right? Because my time is my time, right? But it'll be more convenient for you because that 15-minute appointment would really be 15 minutes as opposed to an hour and a half of driving over, then sitting in the office, filling out some useless form, and then being taken back, then sitting there again. I mean, you guys know that in healthcare, right? If you go for your 15-minute appointment, it takes about an hour and a half, because it's also a musical chairs game, right? So you come in, you sit in the waiting room, then you walk up to the front desk and they hand you some forms, then you sit down again, then they take you back to a room, then the nurse takes your vital signs, then you sit in the room again, then the provider comes, then you sit in the room again, and the nurse comes and gives you the paperwork, then you go to the front desk to check out, and then you leave. Right. And at that time, all I wanted to do was just talk to you, right? And you had like 19 other steps in there that were completely non-value add, So I think, that relationship is really where it's going to come down to. And, transparency in any relationship is, of course, the bottom line.
And very well said.
Good enablers, right? So I do agree with Diana that I think that technology can address all of these, but it depends how you make the technology, right? So if we make a technology, as we did with electronic medical records, and burden the provider with having to put in all kinds of nonsensical data, right, then it's going to require a much higher level for adoption, right? So what we need to think about is relationships as the bottom line, right? And then what kind of technologies can we make? I mean, can you imagine if your Facebook post every time required you to log in and then change your password every 30 days, and then you had to go through like 15 different forms just to be able to post something?
Yeah. As consumer, definitely from what many that I've heard is definitely they would like some quality time with their physician to discuss the actual reason they've been there for, and not just very time limited. So we understand from where you're coming from as well. So let's talk about policies and regulations and the government and politics. Has it always been towards or against MedTech? What are your thoughts, especially in this COVID-19 post-COVID status? Again and again the privacy of health data, the contact tracing, everything is coming up. So do you think regulations and policies so far till now, and even in the future, and the political, the belief system, is it going to work towards, or is it be a potential barrier?
So COVID-19 became a really big catalyst for telemedicine, for mobile health. Again, before, everyone was keeping asking just one question, like, who will be responsible? And just because of this responsibility, it was really hard to create an application for countries where everything is super regulated. North America in such case as well. It's really funny case how I really love to work with Canada, just because they have provinces, and in every province they have their own Ministry of Healthcare. So it's always different. So you can create one project, one application, but you need to customize it for every region. So again, like talking about from outsourced development perspective, it's a really cool market. I remember while speaking at the conferences before, I was working with a lot of African communities and African countries. And they were always telling that in their case, they have more beneficiaries than questions. For example, they let's talk about Kenya. In some rural areas, they have only one doctor in 500 kilometers, only one doctor. So they can't practice normally. And what they created, government have created program, and they just put iPads in every 100 kilometers. So in case someone needs emergency or they have a question to physician, they are going to that tree with iPad, and they are speaking with a doctor. It's really helping, and they didn't. And I was like asking, but still, like, who will be responsible if doctor will, I don't know, make a bad assumption, or it's like just totally different. Still, they were telling that they have more pluses than minuses. That in this case, people have like more chances to survive or to battle with the disease. And what COVID again showed us that such technologies, they have more benefits than we thought before, and we shouldn't be that scared, and we should try it. And in the future, we'll see how it will become popular, and we will all forget. Like 10 years ago, we couldn't imagine that we will use I don't know, iPhone for paying my bills. I couldn't imagine that a cell phone will make this decision. And so the same will go for mobile health as well. We will all speak with our physicians through our personal gadgets, and that will help.
Definitely. So, Dr. Arshad, let's talk about funding. And you are an entrepreneur. You are a CEO of a MedTech company. So, how is the funding out there for MedTech startups, entrepreneurs? Is it some of the might be conflicting companies funding some of the health tech area just to get into the market? Because we do have a lot of potential funders, especially when it comes to the health tech. Can you touch base on that a little bit?
Yeah, absolutely. I think from a funding standpoint, we so once again, because I'm not an MBA, I think that I have a very different take on it. Right, the traditional understanding of funding is that if I give you $1 today, right, in 2 years you need to return back 20, right, and that's the bottom line, and so. Of course, you have, if you can find the right person to spin the right story, right? It doesn't matter what the solution is, right? If you can spin the right story and you can get in front of the right people, you'll get funded, right? There's a reason why, Airbnb ends up, losing their investors $17 billion, right? And how is that possible, right? Or, a company like a Theranos, right, which defrauded everyone, right, including Google and and large companies, right? Because it's monkey see, monkey do kind of stuff, right? So if you know the right people, you can get in front of the right people, you'll get funded, right? Now that's obviously not to say that everything is that black and white, right? Because obviously most of the world lives in a gray, But I think that the problem with healthcare funding is that outcomes in human beings take a lot longer. Right? So it takes me a lot longer to A, change human behavior, right? B, show benefit from that so that then I can replicate and make it grow, right? Because, it's not like, a Twitter account that I'm looking at how many people are going to open Twitter account. And therefore now, that's going to be my, I guess, my KPI, right? That's going to drive how much funding I'm going to get, right? For healthcare, it's quite a bit different. And now there are funders out there, that understand that. And, but the other problem with our financial system, of course, fundamentally, is that we look at everything in quarters, right? I will guarantee you that if you talk to 90%, 100% of the people, they cannot even give you a budget for 3 months for their home, right? How am I supposed to give you a budget and live with it, right? For a company where I have 30 different employees and I'm a small company, right? I have 30 employees and I'm managing all of these things, right? So I think that, so there is a real disconnect in how finances work in general in the real world. I think there is a reason why we have come up with all these, financial products, right? Which are just fancy ways of saying how do we make money move on on spreadsheets, but is that money actually creating any value is a different question, right? And certainly in healthcare, I think this has been an issue, right? So you have larger companies that have never turned a profit. Right? I mean, as a non-business person, I don't understand how a company that has not turned a profit in 10 years of providing telemedicine can be traded on the stock exchange, right? What value are you bringing if you haven't even made $1 in revenue, right? I mean, it just doesn't make any sense, right? But this is how our financial system works, and this, I think, is a real challenge to healthcare startups, right? And certainly to people like me who either don't agree with that premise or don't understand and don't want to play in the same sandbox, right? So I think we obviously always kind of go back to the fact that if we go directly to the consumer and if we can create that value around relationship and bring transparency, that we're going to be able to drive the ball a lot farther than if we are just looking at our bottom lines on a quarterly basis. And and that's one of the main reasons why we have elected so far not to go for institutional funding. Now, at some point, does that change? Absolutely, right? Because I think once we have figured out our own KPIs properly and can rely on that revenue generation, then you'll probably look at it.
Definitely, yes. And that's the question in mind for many startups and entrepreneurs of how to get funded. So, Diana, should doctors be replaced by artificial intelligence and surgical robots?
No, of course not. I mean, we are creating them not for replacing people. We are creating them to help people, like to save their time. We all know how they are working hard. Again, to save people lives. We even during COVID, we saw how robotics are really helping people. Drones delivery, robots delivery. Plus, I know a lot of cases in some rural areas, or like I already told about some African experience, when doctors they don't have enough education or knowledge or experience how to manage some really difficult surgeries. So again, like video conferencing with some plus additional tools. I'm not talking about AI in such case, but sometimes like even like robotics can be helpful. So someone who has enough experience from any part of the world will control and help that surgery. So what I really believe in, it's just a good helping tool.
So we just have a couple of minutes more, and I want to make sure I do check out the questions. But Dr. Arshad, what will the hospital of future look like?
I think the hospital of future should really obviously needs to have a much smaller footprint. That's one, right? Because we clearly hospitalize too many people, unnecessarily, and we usually hospitalize them because we don't have resources or the clarity around resources. So for example, you come in and you've been on an antibiotic and your infection is getting worse, and now we say you need to be put on IV antibiotics. Well, in that whole hospital will stay, your interface with your nurse, your direct interface that necessitates you being there is probably no more than 10 minutes, right? Because she just needs to come in and hang some antibiotics for you that can go in through your IV. Why we can't do that with you being at home, right from day one is a question, right? Now, depending on if you are part of an HMO or an ACO and a capitated product, they will be more aggressive, right? So they will say, no, send them to radiology. Let's have put them on a PICC line, and we will take care of that, right? But I think that really the hospital of the future needs to be reserved, right, for cases that can't be managed outpatient. And in my opinion, at least, I think of the people we admit to the hospital, a large majority can be. The other problem with us is that as population ages, right, complexity around disease gets worse, and our nursing facilities in general should be doing a much better job of taking care of those patients, and they don't, right? So you fall, and the first thing, the reflex for them is to send them to the ER, right?
Sure.
As opposed to taking care of the patient where they are.
Definitely, and I know in our we talked about the privacy and the regulations and how the barriers, but ultimately I think it ended up again and again in the relationship, in the patient communicating, but technology being an enabler or a facilitator. I'm going to take two questions and then we're going to close out the session. One of the question is, how can you ensure a training opportunity for a person who's not tech savvy to make good utilization of med tech opportunities? Diana?
So what I really believe in, it's a first question what that I will ask this person is like, what for you need it? I mean, your needs. If you're just looking for opportunity for business, then I will recommend to look for, I don't know, project where you can become like third party that is helping some of the business, like either a patient, either doctor, or training opportunity in case if you want to be tech savvy by using some products that are on the market already. Then I will just, I don't know, like sit with you and ask people who are already using it, or just ask clients of this service, and they will tell, pros and cons. I don't know if I understood the question correctly, but yeah.
Yeah, you're saying it's basically tailored training based on what the consumer needs. So thank you,
Also training for.
Sure. Dr. Asher, the next question is for you. What can I, as a consumer or a patient, do to encourage providers to use the tech that helps me as well as the care provider? Has it ever happened to you that a consumer has come to you and say, can you use this tech?
Yeah, I mean, I think, I obviously work in the emergency department, so, so obviously we have a little bit of a different relationship, with our patients, but I think, this kind of dovetails in with the first question, right? Because if we cannot create standardization, right, every app that you look at will look different, and every workflow will feel different, and that is going to be a barrier for your average consumer. And that's why, for example, when we talk about Wow Health, right? I mean, we truly believe that you need to have a standardized way of communication, right? So when you go to your Google search engine, right, or when you go to Amazon to buy something, right, you're buying disparate things. You're buying groceries, you're buying TVs, but your experience of interfacing, your relationship with that app, with that software, is fairly consistent. You kind of know where the ratings are, or they're always at the bottom. You kind of know where the product information is. That's towards the middle, right? You kind of know that in the middle are some bundled packages or what have you, right? And I think that, you need to have the same thing. And I think this is one of the issues, is that too many people want to be tech entrepreneurs, want to create their own software, whereas really what they want to be are actually enablers or implementers, right? So they should be looking at existing, right, perhaps platforms, and saying, can I use this, right, so that it is a standardized way for my consumer to be able to interface. And that, of course, dovetails into the second question, which is, if I, as a provider, was interfacing with a similar looking system, right, multiple times, I'm going to be much more comfortable for you as a consumer to want to do it, right? But if you're bringing me one app, my other patient is bringing me another app, third patient is bringing me another app, every time I have to recreate an account and this and that, I'm not interested, right?
Definitely. Yeah, so no, definitely understood. And thank you so much for your time, Diana, today, all the way from team. And Dr. Ashit, thank you so much for your time, for educating us with real-time examples, the frustrations, and very candidly addressing to what you agree and what you like from the technology and what you don't like. It's really a good perspective to us from learning from the provider and as well as a technology expert to you, Diana. And we thank you for your time this afternoon. Visit our website, vendorship.net, for further information. There are several available opportunities in the government sector as well. Reach out to us, to the audience, if you are interested in securing government contracts in the MedTech or the health tech perspective. But thank you, Dr. Arshad. We wish you all the best with your warm health systems. And Diana, thank you for your journey as you move forward. Thank you.
Great meeting you, Diana. Thank you.
Thank you.
Bye.
Bye-bye.